Want to talk about exactly what whooping cough is for parents to know, and how does it end up showing up in kids?
Yeah, so it's one of the many upper respiratory infections that we see. This one's caused by a bacteria. It presents typically like dry cough, mild fever for the first week. But then after that first week is when things kind of get more intense. So the kids will have this very intense, prolonged coughing fits where they're coughing, and they can't breathe in. And then all of a sudden you hear this cough, and hence the name whooping cough.
Oh my goodness. Okay, that is really scary. I mean, we talked about cases going up in our state. Why are we seeing that?
Well, it's hard to tell. You know, there's ebbs and flows to all illnesses. Like sometimes croup is a big croup year. Sometimes we have a bad flu season. So it's kind of hard to tell. But there is the case where some families are foregoing their routine immunizations. And we do see upticks with anytime a disease has the opportunity to have more infections, like measles or pertussis in this case.
Yeah, very true. Okay, so then what are those symptoms we should be looking out for? Because I know you talked about, just right now when you have it, you're coughing, can't really catch your breath. Are there any early symptoms that we could be on the lookout for, or not really?
Not really. I mean, it presents it like just like every other cold, but once you have that very characteristic coughing fit where it's just very, very prolonged, sometimes it can be quite violent as well, where kids are throwing up because they can't keep food down, and then they become dehydrated.
Oh my goodness. Okay, so why are kids so vulnerable to this?
Well, I mean, with adults, we may spend, indoor time with 2 or 3 other adults, but where the kids, they're spending 6 hours with 30 other kids in school. Yeah. And so if one kid has it, the rest are going to get it.
Okay, so if you do have it, I mean, how do you treat it?
Unfortunately, there's not a whole lot of treatment options. I mean, we used to give medications for asthma like albuterol or steroids like prednisone or prednisolone. They don't typically work all that well. So unfortunately, we don't really have much to go with. Fortunately, most kids are going to get through it without any needs, but sometimes, especially kids younger than 12 months of age, sometimes they need to go into the hospital to get oxygen.
Oh my gosh, that's scary, for those parents, and I'm sure for them too, to have to know that there's not really a good treatment for this, and they're just going to need to go to get that care. But we're lucky that we have Phoenix Children's here, who does give such great care to kids all across our state and really the nation too. So finally, as we start to wrap up here, I want to ask what families can do right now, I guess, to prevent the spread. Because like you mentioned, some of these things, when you're a classroom of 30 kids or you're in the daycare, it's hard really to think that you can stop it.
Yeah, sort of the easiest one is just kind of doing your routine immunizations. I mean, we give the immunizations, and that's still, the CDC still recommends that as a routine immunization for all children. And the other thing that's kind of hard is just keeping your kids home when they're sick. Yeah. I know it's tough. It usually means that, mom and dad have to stay home too, but that's where kids are getting it. So when someone's sick and they go to school, they're spreading it to at least 28, 30 other kids in their class.
I know, it's hard. I know mom and dad, they're like, well, I don't have that many sick days, or my work is piling up, but it's just going to be better for everyone if you could just take that pause and be there. All right. Thank you so much for being here, Doctor. We really appreciate it. Some really great